White blood cells are required to fight infection, and platelets are required for clotting of blood. Side effects are dramatic, or the quality of life is not acceptable. We just decide that this is not for us, because ultimately we cannot let the treatment be worse than the disease. But mostly our aim as veterinarians is a good quality of life. This is Meera. She's an 8-year-old female spayed lab who was diagnosed with an oral buccal mucosal melanoma. We did a CT scan to understand the extent of the tumor locally, as well as to see if it's spread to any other parts of the body. On the CT scan, her mandibular lymph nodes and retropharyngeal lymph nodes, which are here and here, were enlarged. We did a fine needle aspirate of those, and those were unfortunately metastatic. So she underwent a surgery to remove the primary tumor, as well as a surgery to remove the mandibular as well as the retropharyngeal lymph nodes. Luckily, there was no spread in the chest as well as the abdomen. Because this is a highly metastatic tumor, a tumor that can spread to the lungs as well after spreading to the lymph nodes, we've decided to follow up with chemotherapy. So Meera is here to get her third dose of chemotherapy of a drug called carboplatin. It's given once every 3 weeks. She's tolerating chemotherapy quite well and is quite happy otherwise. The goal of chemotherapy in Meera's case is to try and ensure that the cells don't go to the lungs, as we know that the behavior of melanomas is very aggressive. There are very few drugs that we have at this point which actually work very well against an oral melanoma, but carboplatin and pallidea is a few of them which we have literature for. There are other immunotherapy drugs which are available that could be tried as well.